Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. How are you? Thank you and welcome to my weekend open clinic. Today's topic is very important for so many reasons because over time we have had so many misconceptions about this topic. Today we're going to talk about Down syndrome. Down syndrome. This is a case that so many people have stigmatized. So many people have called the kids that have this condition so many names. So many people believe it's not their portion. So many people think it's a curse from the village. So many people think it's spiritual. Unfortunately, when we have all these misconceptions, all this myth about Down syndrome, those kids, those people with Down syndrome end up not getting the best, even within their family. So we've noticed kiddies that are Down syndrome in a particular family, their parents even neglecting them. I want to remind you about this. Once you're a parent, it's a big responsibility. When God trusts you to give you a baby, it's not your baby, it's God's baby. Regardless of how that baby showed up, you should take 100% care of that baby. So, babies that have Down syndrome are also babies. There is absolutely nothing wrong with them. They might have challenges, but over time they will overcome their challenges. And with modern technology, so many of them can live up to age 60, even beyond age 60. What we need is to understand what Down syndrome is all about. And that's what I'm going to help us to understand today. So please, once you join the clinic, tell me who you are. Introduce yourself and share this video with everyone out there, especially our people back home in Nigeria. There are so many people that will not attend this clinic because they believe it's not their portion. Please copy this link and share this video to everyone out there. I'm going to start soon. Also, if you need any help, admin is in the clinic, Chinyere is in the clinic, COO is in the clinic. They will help you to get the help you need. If you need to be in the event coming up on Sunday, on the 30th of this month, Advanced in Maternal Age Masterclass. It's important to understand that advanced in maternal age is the top risk factor for having a baby with Down syndrome. So it's important you register for that event. And I'm going to quickly start. So once you join, just join me and we'll have interesting discussion. So Down syndrome is actually a genetic disorder. It's not a cause. It's not spiritual. Any woman can have a baby with Down syndrome. So it's caused by an abnormality in cell division. So there's something we call chromosomes. We will normally have a woman with 23 complete sets of chromosomes, a man with 23 complete sets of chromosomes. When they come together, 23 plus 23 will give us 46. So an individual is made up of 46 completed chromosomes. 23 from the father, 23 from the mother to make it 46. Now, when you now want to start your own family, as a man, you're going to contribute 23 complete sets. The woman will contribute 23 complete sets to make babies. Now, in Down syndrome, for some strange reasons, are the 21 chromosomes. So Down syndrome is a chromosomal problem at chromosome 21. So I want you to say 21. 21 is anytime you hear Down syndrome, remember 21. So it's at chromosome 21 that we have that abnormality. So Down syndrome is caused by abnormal cell division that results in extra genetic material from chromosome 21. Now, kiddies that have this problem will have developmental and intellectual delays. It's delays, it's not denial. They will learn differently. So the extra genetic material will cause developmental changes, physical features. So babies that have Down syndrome, there's a way they present. I'm going to talk about the looks and the symptoms of babies that have Down syndrome. Now, there are so many variety presentation of Down syndrome. So Down syndrome varies in severity among individuals. So no two babies can have exactly the same presentation of Down syndrome. It can cause a lifelong intellectual disability and developmental delays. It's delays. If we love this baby the right way, if we take them to all the facilities they need, if we get them all the professionals they need, they can attend up to age 60. They can have their own family. There is absolutely nothing wrong with babies that have Down syndrome. Now, they can have medical problems. Majority of the problems they will have is in the heart and the gastrointestinal system. So it's important to understand that if you have a baby with Down syndrome, it's a lifelong condition. And we can diagnose this during pregnancy. So if you happen to have the risk factors, which I will explain further, when you are pregnant, it's important to go for genetic screening, after which you can go for genetic counseling. There is nothing wrong with your baby. I'm telling you this as a father. It doesn't matter how your baby presents. You're a mother, you're a father. Take good care of your baby. Now, Down syndrome occurs in approximately 1 in every 800 live birth. So it's somewhat common. 1 in every 800 live birth. So it's important we diagnose this early. It's by far one of the most common chromosomal abnormality in pregnancy. Like I mentioned, thank God for modern facilities. With medical research and medical help, babies and infants with Down syndrome can reach their milestones. They can get to up to age 60 and more. Now, generally, because of this extra chromosome in chromosome 21, they will have about average size. They will grow slowly. So if you see a baby with Down syndrome, some of them will remain shorter than other kids. It's okay. It's not something to worry about. So depending on the degree of learning disability, most children with Down syndrome will need help in walking, will need help in talking, will need help in school. Over time, they can become semi-independent. As an adult, there are so many Down syndrome adults out there with work, thriving, started their family. So the fact your baby has Down syndrome doesn't mean it's the end of the world. With the right care, most of them will go further to lead full lives and achieve typical life goals. So in this clinic, I'm gonna explore the factors, the risk factors you need to be conversant with. Most children with Down syndrome will have mild to moderate cognitive impairment. It's impairment. With the right help, they will be fine. Some of them will need help with their language. Some of them will need help with remembering stuff, with their memory. So these are the things you should be conversant with. Now let's talk about the symptoms. How do babies with Down syndrome present? Remember, each person with Down syndrome can present differently. But the symptoms I'm going to mention can be varied. Some kids will have it, some will not have it. Now, they have a distinct facial features. So I'm going to concentrate more on the facial features, okay? Majority will have a flattened face. Flattened face. That's the first presentation you will notice. Majority will have small head. Number one, flattened face. Number two, small head, short neck. So flattened face, small head, short neck. Typical of majority of babies that have Down syndrome. Majority of them will have protruding tongue. So their tongue will tend to protrude. That's sort of the classical presentations of babies with Down syndrome. Majority will have upward slanting of the eyelids. We call it palpebral features. This can happen, this might not happen. They will have unusually small ears. small shaped ears. Their ears are very small for some reasons. Generally, their muzzle tone will be poor. So when you see a baby with Down syndrome with a baby that doesn't have Down syndrome, the muscular tone will be poor. They will have broad, short hands with single crease. So you see how many creases I have in my hands, right? Can you see? I have 1, 2, 3. So in babies with Down syndrome, they will have only one crease. This is a classical presentation of Down syndrome. Babies that have Down syndrome will just have one single crease in their palm. They will have relatively short fingers, small hand and feet. They will have excessive flexibility. They will have tiny white spots on their eyes we call brush-fed spots. And generally, they will be of short stature. So these are the classical presentation of babies with Down syndrome. Now, it doesn't mean that all the babies with Down syndrome will have all this. Some will have some will not have some. Now, when do you need to see a doctor? Remember, Down syndrome can be diagnosed from birth when you're pregnant. Okay, so there are a couple of tests we can run to identify if your baby is going to have Down syndrome. So majority of pregnant women now, especially if you have the risk factor, which I'm still going to come to, you need to be on the lookout. So children with Down syndrome are usually diagnosed at birth. Now, if you have some questions when you go for your screening in pregnancy, please follow up with your doctor immediately so you can go for genetic counseling. Now, I know you will really want to know specifically what leads to Down syndrome. I've mentioned it again, but I'm going to mention it again. Now, human cells are normally, a pair of 23 chromosomes. So one of the chromosomes in each pair will come from the father, the other one will come from the mother. Now, in Down syndrome, the problem is in chromosome 21. The cell division in chromosome 21 will lead to extra, partial, or full copy of that chromosome 21. So it's actually the extra copy of the chromosome 21 that leads to the problem. So this extra chromosome 21 can begin to cause all those developmental features that I've already mentioned. So the basic cause of Down syndrome is chromosomal abnormality. There are a couple of variations of the abnormality. Some can have the condition we call trisomy 21. Trisomy 21 because that additional chromosome is called trisomy and it happens at position 21. Some can have what we call mosaic Down syndrome. So that's a rare form of Down syndrome, a combination of extra cells and copy of chromosome 21. Now, some can have translocation type of Down syndrome. Now, the big question is Down syndrome inherited? The answer is yes. However, majority of Down syndrome are not inherited, but some can be inherited. It's caused by the problems and the mistake during the cell division in chromosome 21. But if you have the translocation syndrome, it can be passed down from a parent to a child. So only about 3 to 4% of children with Down syndrome will have the translocation aspect. So that means either the mother or the father passed it down. So when the mother and the father came together, if the mother has this abnormal translocation gene and the father has the abnormal translocation gene, a combination of two translocation genes can lead to Down syndrome. Now, when you have balanced translocation, which you inherited from your mother or your father, they can go and rearrange your genetic materials on chromosome 21, leading to Down syndrome. Now, because the parents are the carriers, they might not necessarily manifest with Down syndrome, but they are carriers, just like sickle cell disease. So if you're AS, you're a carrier. It doesn't mean you have sickle cell, but you can pass that S gene to your child. And if your child meets with someone with S, they will have babies that have sickle cell. So yes, some forms of Down syndrome can be inherited, but majority are not inherited. Now, what are the risk factors? This is exactly where I want to lay my emphasis on. Number one risk factor for having a baby with Down syndrome is age. So for some reasons, when you get to age 35, which we classify as advanced in maternal age, your chances of giving birth to a baby with Down syndrome will increase. This is because at this age 35 and above, you have older eggs, which have greater risk of having abnormal cell division. So women that are age 35 and above, this is why we actually chose the topic for this month's summit, Advanced in Maternal Age Summit. We want to hold your hands and tell you what you need to know. So if you're currently 35 years and above and you're believing God to have a baby, possibility you might have a baby with Down syndrome is high. Now, their risk factor increases. It doesn't mean that if you're younger, you can't have babies with Down syndrome. Matter of fact, most children with Down syndrome are born to women under age 35. So think about that. The reason is because we have more pregnancies and more good outcome of pregnancies below 35. So the more babies you have, the more the probability you have Down syndrome. But majority, the biggest risk factor is age 35 and above. I want you to understand, it can be a little bit complicated if you don't understand it. Age is a big factor. But because we have more babies to women that are below 35, they tend to have more. But that's number one risk factor. Now, if you are a carrier of the genetic problem, like if you have the carrier of the translocated gene, which I've mentioned, and your partner also has translocated gene, when you combine both of them, then the baby will have Down syndrome. If you have one child with Down syndrome, possibility that subsequent kids might have Down syndrome is high. So parents with one child with Down syndrome and parents with translocation gene themselves can have another child with Down syndrome. So this is why you need to see a genetic counselor. Now, having said all this, I'm not here to put fear in you. I'm here to tell you that babies that have Down syndrome are amazing babies. They have their potentials. They are smart. They are everything you want in a baby. What they need is care. Give them the best care and they will attain the best potentials exactly how God created them. So Down syndrome, it's not spiritual. It's not a curse. I don't want anybody telling me, oh, you bind and cast, it's not my portion. That's nonsense. It can happen to anybody. Unfortunately, there is no way you can prevent Down syndrome. There is no environmental factor that can cause Down syndrome. It is just what it is, okay? And unfortunately, majority of us are not conversant with genetic counseling and genetic testing. Some women will not even accept to go for genetic testing, but there are solutions. All the medical problems we will notify and identify in babies with Down syndrome, with modern technologies, we can handle them, okay? So that's my presentation this afternoon. I'm going to open the clinic now, and please, let's have a lot of questions. So I can see it's only admin in attendance today, which is okay. So admin, please, start asking your questions. I want all the admins to ask me at least 3 questions. Immediately after this clinic, I'm going to repeat this clinic in Facebook. So admin, start asking your questions. Starting from COO, I need 3 questions from each person. So Chinyere, 3 questions. Kene, 3 questions. And we'll see whoever is behind the scenes. So the clinic is open now. Start asking your questions. We have at least about 10 minutes, okay? Ask your questions. And please, if you didn't understand Down syndrome before now, this is the simplest explanation you can have about Down syndrome. After this clinic, change your perception, change your orientation, change your attitude towards parents with Down syndrome babies. There are some of your kids that bully and shame and abuse babies that have Down syndrome. In Africa, majority of the so-called Christians abuse these babies, call them imbecile, call them different names. That's being mean. You should stop from today because anything can happen to anybody. There is nobody that has immunity in life. So be kind. Okay, so let's go. Ask your questions. Thank you, Doc. Do individuals with Down syndrome have a lower life expectancy? Yes. Remember, with careful medical follow-up, they can get up to 60. Of course, 60 is not the average life expectancy of people. It's below, I think it's about 80 or thereabouts. Women have a higher life expectancy compared to men. So, but with proper management, they can get to 60. Of course, I mean, think about that. You know, a baby that has a lot of things to contend with, developmental abnormalities, intellectual abnormalities, medical problems, especially problems with the heart and the GI, of course, they're going to have a lot of medical challenges. Anytime you have any medical challenge, your life expectancy will be reduced unless you flip the odds. So yes, the life expectancy for some reason is reduced because of things they have to contend with. So anytime you have a medical problem, diabetes, hypertension, obesity, cancer, asthma, any of those things can reduce your life expectancy, because when you begin to manage them, some of them will present with complications. Like babies that have Down syndrome can have problems with their eyes, GI, heart. So imagine when your heart is not functioning appropriately. Of course, your life expectancy will be reduced. Okay? All right. Please keep asking your questions. During genetic testing, if a couple is discovered to have translocation gene, what's the best advice for them? This one will really, really shock you. So there are certain decisions that parents will make that might be very, very, very tough. Now, Down syndrome and other syndrome, remember there are so many other syndromes. Down syndrome happens to be the most common. There are so many tough decisions you have to make as a parent. Now, if we diagnose your baby, first of all, you have to go for screening and confirmation test of any genetic problem. So if we diagnose your baby of Down syndrome, we are going to cancel you. Now, the decision of what you want to do at that point is strictly yours. So a couple can decide to terminate the pregnancy, or they can decide to carry on with the baby. So those are the two choices. Very tough decision to make. So some couples will just, swallow it and go for termination. And some couples will ride the storm. Now, what will I advise you if you're a parent? Brace up. Any baby that God gives you is a responsibility. There is a reason why God is giving you babies with disability. God saw you as an angel. It's not just anyhow person that God will just go and give a baby with challenges. If you notice, if you're a parent with a baby that has challenges, be it autism, be it Down syndrome or whatever, they still attain their potentials. There is no baby that is not made special. They are rather gifted differently. I'm telling you, if you give them love, there is absolutely nothing they cannot achieve. So, but the choice of keeping that baby is yours. And once you make that choice, in developed countries, they will honor your choice. So if you decide to terminate the pregnancy, the doctors will terminate the pregnancy. If you decide to run with the pregnancy, they will run the pregnancy and they will support you. Very tough decision. No, Chinyere, you're asking very, very interesting and very important question. Matter of fact, I had wanted to make sure people know the difference between Down syndrome and autism. They are not the same thing. They might present with similarities in the gray areas. But Down syndrome autism is a multi-complex, multi-gene, environmentally related medical issue. Down syndrome is specifically what I've just mentioned. The focus is on chromosome 21. We know that for sure. Trisomy, translocated genes, or chromosome that has problem in chromosome 21. What do you call it? Autism is a spectrum of so many things that come into play. So Down syndrome and autism are not the same. Okay? Matter of fact, I think the next clinic I will run next Saturday will be to have a comparative analysis between Down syndrome and autism. Down syndrome versus autism. So I'm going to explain the difference. So remind me to make it my next topic, because there are some topics that people don't really take interest to because it's not fertility related, but it's very important because kids that have Down syndrome and kids that have autism, they are bullied. Now, the major difference between kiddies that have autism and kiddies that have, Down syndrome. Classical presentation of Down syndrome, you will have all those facial features. In a kiddie that have autism, they will have full development. They will look normal. Everything will be okay until they start exhibiting all those tendencies. So that's a major difference, okay? But they are not the same. What type of screening is used to detect and diagnose Down syndrome? This is an amazing question from my COO. Now, there are specific blood tests. There are specific sampling we can use. So we can use blood tests. from both parents. So during genetic screening and genetic counseling, we're going to check the genes of the mother, we're going to check the genes of the father, and over time, if we discover anything, we're going to inform them. Now, for the pregnant woman proper, there are some investigations we can run. We can collect her blood, or we can gain access to the pregnant belly and collect fluid from the amniotic sac and take it for checks. So it depends on where you live and availability of those technologies. So there's a particular test we call chorionic villi sampling, CVS. So these are available in some developed countries and is invasive. So invasion means we have to get access to the womb with a special syringe, collect the fluid there, then send it for sampling. The majority of your genetic screening are going to be done with blood. Okay? Yes. All right? Okay, guys, we still have about 5 minutes. And we have 7 people in the clinic. So who are these 7 people? I've already seen COO, I've seen Chinyere. Who are the other 5 people in the clinic? If you have any questions about Down syndrome, please ask. I don't want anybody shaming any baby with Down syndrome. I don't want anybody talking bad to parents with babies with Down syndrome. That's not good. Especially if you pretend to be a Christian and you don't love people, you just show them the opposite of Christianity. It doesn't make sense. Now, I want you to also change your mindset. Oh, it's not my portion. You bind and cast Down syndrome. It's not in my family and all those nonsense. The people that have challenges in life, it's not because they're not prayerful. It's not because God doesn't love them. It's not because it's their portion. Things happen, they happen. There is nobody in life that doesn't have challenges. So let's understand things before we say certain things to hurt people. Okay? All right. If we don't have any other question, then we can adjourn and continue in Facebook. But thank you so much for coming. COO, you can confirm if we don't have any other question regarding Down syndrome today, we can adjourn so we can continue in Facebook. So join me in Facebook, our page, and we have a robust discussion about this. Okay? COO, give me the signal before I go. Okay, thank you so much for coming. I appreciate you. If today is the first day of attending my open clinic in YouTube, it's something we do every week. Every Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. Then every Saturdays, we used to start around 12, but because of the time difference, we now start by 1. So every 1 p.m. on Saturdays, you will see me in this channel talking about topics I love talking about. Thank you guys so much. And please make sure you subscribe. Make sure you share this video and make sure you like this video and make all your comments. Until I see you next Tuesday, God bless you and enjoy the rest of your weekend. Bye-bye for now.